Guys, I am super excited about my client today. I want you to take a look at this. What we have right here is a very swollen toe. Turns out our client has ripped off his toenails, and for about what, the last 3-4 months, it has been continuing to grow and then fall off. What we have now is it might not look painful, but when I touch it, I can see his face do one of these things. So we know that there is pain. We can also see too that that the skin is starting to grow up on top of the nail plate, turning our involuted nail into an ingrown nail. So we are gonna work very closely on debulking this area right in the lateral fold to give him instant relief. And then we're going to apply an Onyfix band, which is going to retrain the growth. And then we're also gonna apply a distal half band to relieve some of that pressure as well. So pretty much I'm gonna be his favorite person after 30 minutes. Let's get started. So now looking at the other toes, what we're just gonna do is we are going to just continue to cut these down so they can have some healthy growth. We have some buildup of keratin right here, so we're going to just thin this toenail down so it looks aesthetically pleasing, okay? Starting off my process, as I use a soakless system called a dry pedicure. So what I'm gonna go ahead and do is I'm gonna use my Podiatrists foot and shoe deodorant, and I'm gonna spray my client's foot. While I'm talking to them about their foot, there are 2 questions I'm gonna say. The first I'm gonna start with is, how do your feet feel?
They hurt.
They hurt. I am going to guess that that is right in this area. Am I correct?
Yes.
I can tell they're super inflamed right here. So I know my client has pain, but I need to know, is it coming from this side or this side? By looking at it, I would assume on both sides because there's a lot of inflammation, but I'm going to talk to them by just doing a very light pressure and say, how's that feel?
It hurts.
That hurts. Okay, because of that, I am going to grab my Podiatrists callus softener and I'm gonna spray that about 2 squirts right on the toe. And what this is gonna do is it's gonna start moisturizing and breaking down those dead skin cells, and I'm just gonna gently rub that into the nail plate and around that lateral fold because this is gonna be really sensitive. It is going to hurt before it feels better, but at least this is softening the skin since I'm not soaking them, okay? So as I'm letting that sit for about 2 minutes, I'm gonna go ahead and cut the toenails. There's not a whole lot to cut here, and I would rather exfoliate this. You just wanna use small little bites with the tip of the blade. What I really like, especially on these toenails that are curving like this, getting underneath, being able to use that blade and just slide it right underneath. I'm still looking to make sure I don't get their hyponychium. If you accidentally cut their hyponychium, you will never see that client again. It hurts. Just like this. Little small bites, just gliding my nippers right across, making sure I have controlled bites. Okay, and we're just gonna go ahead and exfoliate that, not a whole lot to cut. Then I'm gonna go in with my Erica's medium diamond file and I'm going to shape these. This is what's really important, and what a lot of people don't do in the maintenance for their toenails is that we just cut them, but we don't shape them. We wanna make sure they're straight across, and we wanna make sure that there's no nail spike. So what I've just done is I've just trimmed and shaped the toenails, and now I'm removing the debris, and we are going to tackle this right here. I am gonna use my pusher to release the cuticle off of the nail plate. Very, very gentle. All right, this is so that I don't overfile. The nail plate, I am not using it to scrape the dead skin cells. I am gonna allow my bits to do that. I just wanna release it right off the nail plate. Now that I've successfully done that, I am going to use my professional e-file. All right, it's important not to be using a drill or a Dremel. And I'm going to use my PEDI plus toes kit. The first bit that I am going to use in this kit is the long and lean and medium grit. It has diamond on this top, and I'm gonna use that diamond head and gently push it into my proximal fold area and exfoliate the dead skin cells. So this is great for your diabetics. This is great for your immune compromise. We are going to run at very low speeds. We are at 5,000 RPMs in the forward direction. I'm gonna keep my back flat, and here I am just roughing up the nail plate and removing dead skin cells. I'm just tracing it. If my client is moving, it's just because it's ticklish. Just like this. We're just shaping the proximal fold area. Being very gentle. I don't want to start messing with that lateral fold quite yet. I know it's really tight, so I'm going to use a different bit to be able to thin out that lateral fold and relieve some of that pressure for him, okay? Same thing, you can see the overgrown cuticle right there. I'm just gonna do several passes. See how that bit just nicely lifts it? We are applying no pressure. We're allowing the tool to do the work for us. So how Diamond works is it has these little particles where it's just nicely scratching off. What's nice about using these Diamond bits is it is very gentle. It is good for your middle-aged, it is good for your diabetics, it is good for your immune compromised. We're literally just scratching and we're reducing water because this has to be done dry. If it was done wet, you wouldn't get the same results. The Diamond particles need to catch on that dry skin to just lift them up and off the nail plate, just like this. We're just grooming. It's like petting a kitty, very gentle. All right, then I'm gonna switch my e-file to reverse and do the opposite side. And guys, this is a very fast process. We are in a training setting where I really want you guys to see how I'm sitting, the position of my body as I talk through this. But I can usually do this all 10 toes within just a couple of minutes. Now, depending on how much cuticle work you want to do, really depends on how you're pricing out your service. There is somebody for everyone. My model today took off work in the middle of the day because he was in so much pain when he heard about the model I was looking for. It was worth taking that time off to have a solution. Definitely. Before I go in with a bit, my unicorn is I am going to take my Erica's excavator and I am going to get in between the lateral fold and see how far this nail plate goes into the tissue. I'm taking this smooth edge and running it against the skin, and I'm taking the little spoon part and getting it underneath the nail. So as you guys can see right now, this is like a little treasure hunt where we're just removing soap scum, dead skin cells, debris, dog hair, and I'm just seeing how tight we are to see how far I can go with my bit. Really what I'm trying to see is how far can I go until my client jumps. So you guys see that right there? I am literally lifting up his toenail that is growing down into the tissue. It is out of my scope to cut this out, but what I can do is I'm gonna take my unicorn bit and I am going to thin this nail plate along this side, all right? I was able to cut out a piece right at the free edge where you can actually see this gap. This is a wedge section when you cut something out and then there's just this huge indent from just so much pressure. All right, guys, this is so cool. Right now is we are starting to relieve this pressure right here. What I suspect right here is we got a little blood a blood blister there because what's happened is, look at this right here. When he was self-operating, we have some nail spike that was literally so rough that it started growing and piercing the tissue. And anytime his foot was having impact, is that sharp point right here was poking into the tissue and he just said ow. It's okay, so we are going to cut that out right there and instantly relieve that pressure for him, pulling down the skin. I know it's very sensitive, getting right up underneath. It's very inflamed. Cutting that out for him. You might see your clients like do a little dance. Is it because you're hurting them? They already hurt themselves. You're just relieving that pressure. Look how inflamed it is. So let's go ahead. Let me remove some of that dust so you can see what we just did. Be very careful not to cut the tissue. I'm not cutting any live tissue. I am within my scope. But what I am doing is relieving any pressure. So look what we just did. We just cut that out right there. And of course it's gonna be a little tender, but I bet in 3 days if I were to reach out to him, he'd be like, that feels so much better. The body wants to quickly heal itself. All right, now that I can get my little, there's a little bit more This is why it's important to, after you cut your toenails, is to use a file and to round them so you don't have these sharp edges just cutting into your tissue. Oh, so painful. How's that feel?
It's okay.
It's okay. Literally, this nail, you guys, is like cut with, did you use a pocket knife?
No.
A box cutter? All right, I'm now using my unicorn bit with this rounded edge, and I'm going to rough up the area in which I'm gonna put my Onyfix band. So I am going to actually put an Onyfix band hard application right here at the proximal end, as well as a half band right there at the dorsal end. I actually, because he's feeling so much pain on both sides, will probably do a full band. All right, so right here, I know there's a bunch of pressure, so I am just thinning this down. I'm thinning down the nail plate, you guys, so that my client is getting that instant gratification of relieving the pain. So I broke the seal that was really tight by using the callus softener and then just gently taking my scoop to see what I was working with, remove some of that nail plate that literally was chewing up the edge of his toenail. And now I'm taking my bit and laying it parallel. I'm being very careful. Look at that area right there, how it's purple. I don't want to cause any more problems, but you see that really tender red area right there? That is exactly where that little blood scab was that was piercing. Very, very gentle. Very, very gentle. I'm allowing the sharp diamond tools to do it themselves. I am using a diamond because diamond scratches. Scratching is important. I don't want to use a carbide. I don't want to use something that is too aggressive because it is going to hurt, and it would also catch and cut the skin. Another thing that I don't want. Thinning down. All right. I'm going to go ahead and switch my E-file to reverse and work the opposite direction. Again, I am roughing up the nail plate for my Onyfix application. I'm roughing the sinus area because I want to make sure I have a good bond between product and nail plate, and then I'm flossing. So if I was doing a manicure, I would never use this flossing method, but because my goal right now really is to thin out the nail plate that's in this lateral fold, is I am doing this process of flossing and thinning and reducing this pressure. Okay, so I am just taking my excavator again, removing that debris, making sure everything is nice and rounded. Still have a little bit of a spike right there. I can take my rasp or I can take my bit, and I'm just gonna nicely smooth that edge. Now this is something that your client can do at home. Is what I would recommend is having these for resale, and when your client is starting to feel some pain in between services, is encourage them when they get out of the shower, if they're feeling any kind of pressure, use the rasp, and how to use it is where their skin, use the smooth part, and where you see the fluted teeth are to put that underneath the nail and start to pull. All right, because the nail is growing down into the tissue, so what we're doing is just thinning out and relieving some of that pressure. It is a process. The nails didn't get like this overnight, and we want to make sure that we're giving that relief without jeopardizing our license. And this is something they can do at home that's actually helpful versus going back to the let's cut it out and not get anywhere. Now that I've successfully prepped the nail, I'm now gonna go ahead and move forward with my Onyfix process. Starting off with degreasing the nail with alcohol. You wanna use at least 70% or greater for cleansing the toenail. I prefer using a nylon brush, that way I don't have any lint that is compromising my application. I can tell that my client's foot is very inflamed. We've helped reduce some of that pressure, but what I'm gonna go ahead and do is I'm gonna use Onyfix hard and apply it to the proximal end, and then I'm also going to do a second band right here to help relieve some of that pain, giving him instant relief. So we're gonna go ahead and apply 2 bands. Now that we've degreased the nail, we are going to take our primer. Again, less is more. 1 drop in the cap with a clean Q-tip. Gonna swirl that Q-tip inside, make sure I got some primer, and apply the primer to the entire nail plate. This is going to help with my product bonding. So be sure not to skip this step. Make sure you get it in that lateral fold, and if you get any on the skin, just use the other end and clean it off. I'm now gonna grab my flashlight and cure the primer for 60 seconds. Today I'm going to go with Onyfix Hard because we are working with a thicker nail. This composite is more like a putty, so one little full turn is 1 millimeter worth of product. Since this is a larger nail plate, I'm gonna give myself a little bit more, taking my spatula and just scraping it against the container. I always wanna put my cap on right away because I don't want the air to start drying out my product. Now, this is a putty consistency. So I am going to use the warmth of my client's nail plate to just start to soften this putty as I make a tubular band. So what it's really gonna look like, I shared with him, is that it's gonna look like a macaroni noodle on his nail plate. So as it gets warmer, it gets more pliable, and I am going to make a band that is 2 millimeters wide by 2 millimeters high. I'm going to gradually be moving that up the nail plate. And this is why it's important not to put too much primer, because we don't want this band to be sliding all around the nail plate. We want to make sure that the composite is able to bond properly to the nail plate. So as I push it around, I don't want the composite to touch the skin. I want to make sure it's also straight across and uniform. That way, as he's wearing boots and living daily life and working, that as his foot is taking impact, that tubular band is going to be able to flex with the nail. 2 millimeters by 2 millimeters is close to the proximal fold, making sure there's no divots. The more you work with the product, the easier it becomes. And try to just create a uniform shape. If you have a spot that's more sparse than another, when that foot takes impact, it's going to have a greater chance of dislodging. So having a uniform shape really helps with keeping the band intact to the nail plate. We don't want it to prematurely dislodge. Now that I've applied the Onyfix Hard, I'm gonna let it go ahead and cure with my LED light for 60 seconds. So after I've talked with my client about how much pain they're feeling, I really want to give them some relief. So I'm going to apply a half band to the distal end of the nail. I just need a little bit of the hard, and be sure that you have a different spatula, because that way I'm not contaminating the Onyfix too. And the same process of doing my full band, I'm going to warm up that product, create a tubular shape, that's very important, and I'm going to get it as close to that lateral fold as possible. All right, you could also use the Onyfix Soft as well and do a double band, because 2 bands of soft is as strong as 1 hard band. Now be careful when you start patting it, all right? This is an acrylic, we're not patting it. We don't want it to be flat. We really want to keep that tubular macaroni shape, because that's what's also going to help keep the band in place. Now, I am only putting this band here to help my client have instant relief, because they came in with pain and I want them to leave with no pain. I want them to be a believer in the product. So with that being said, because this band is so far to the distal end, there's gonna be more movement. And because there's more movement in the nail, there's gonna be more bending. That bending means it's going to pop off within about a couple days to a week. So they should not be surprised that if in a couple days it falls off. If it falls off, it has already done its work. What it's just doing right now is using light tension to lift the nail plate from that nail bed ever so slightly, because there's a lot of movement underneath, to give that inflamed tissue a break. But I am now trying to get the band as close to that fold with a little bit of taper. That way as it grows out, it doesn't get stuck on bed sheets or a sock. Keeping the macaroni shape, 2 millimeters by 2 millimeters. And I'm gonna make it a little longer because I have extra product and I know my client has a lot of discomfort. So usually this just needs to go right in between half. Just gonna taper that a little down so it doesn't catch. Again, setting realistic expectations for our client, so when it comes off, they understand that that the product wasn't secure. It's just that we don't have a long life expectation for this band. So usually for the distal band, you would just go from the lateral fold to middle. I had a little more product, so I just extended it out. I wouldn't necessarily do this. I just didn't want to waste the product. So now that I have my band in place, I'm gonna take my LED light, and for 60 seconds, I am going to cure the composite. Make sure you're about 2 inches away. The band that is towards the dorsal end will be coming off in the next couple days. It is very important to communicate that to your client. The band in the back for the proximal area should last for at least 3 to 4 months. For whatever reason, if it dislodges, then your client needs to come back for reapplication. During that reapplication, you are going to place the band back at the proximal end, not where the band had fallen off. That's really important because that correction really needs to happen at that matrix level where we're freezing the nail plate and allowing it to grow out. All right, I have nicely cleaned up all of the toenails, but I see that I have some extra buildup on the pinky toe. So what I'm gonna do is I am gonna grab our PEDI debolt kit, and I am going to use the tapered carbide barrel. I am going to reduce that thickness. And it's important to remember, anytime that we are running with carbide, we wanna be sure that we are running at high RPMs, even though this toenail is small. So because this toe is really small, I am going to work more with zone 1 of my bit. All right, and I'm gonna work from right to left, and I'm going to thin down the toenail. I would do the same process on any of the toes that look like this. I want to be sure not to move too much because as the nail is pinched up like that, the nail bed is to follow. So I don't want to get to the point where I am filing too much of the nail plate and onto the nail bed, right? So on a healthy, normal nail, the nail bed is underneath the nail plate. So if the nail plate is pitched like this, that nail bed has also grown underneath it. I've used alcohol. I love alcohol in my nylon brush just to remove the debris. And look at it, it is nice and flush, just like that. If you're getting closer to the nail plate, but you wanna keep going, that's when you would just switch out your carbide bit for a diamond tool like the long and lean that we use to do our cuticle cleanup, just to gently scratch and to exfoliate the nail plate. When you don't wanna go too far with a carbide, we wanna make sure that we're keeping and maintaining the integrity of the nail plate. Guys, that was so exciting. My client is feeling great. I have relieved that ingrown toenail. I was able to remove that nail spike that literally gave him a blood blister, okay? And I just made over $120, right? He feels like he got a deal. I made $120. I am super excited. If you like videos like this, please go ahead, like and subscribe, and I will show you more about my dry pedicure and how Onyfix can either save you from those ingrown toenails or make you money with application.